chairpersons and 39 members are cabinet members and representatives of civil society organizations and one private sector. The inclusion of the civil society organizations and private sector encourages the forging of public-private partnership, engaging all stakeholders to cooperate and be united in the implementation of DRR in all aspects. These four pillars are headed by four cabinet secretaries: preparedness by the Interior and local government to establish and strengthen capacities of communities to anticipate, cope, and recover from the negative impacts of emergency occurrences and disasters. This includes citizens-based organizations and the local government units. Response by social welfare and development to provide the preservation and meet the basic needs of affected population during or immediately after a disaster, which includes relief, rescue, and early recovery. Prevention and mitigation avoid hazards and mitigate their potential impacts by reducing vulnerabilities and exposure and enhancing capacities of communities. This is led by the Department of Science and Technology. And rehabilitation and recovery, led by the Planning Office, to restore and improve facilities, livelihood, living conditions, and organizational capacities. The National Disaster Risk Reduction Framework is a conceptual and operational framework on how whole of society can work towards safer, adaptive, and disaster-resilient Filipino communities towards sustainable development. The NDRRMF conveys a paradigm shift from reactive to proactive DRRM, wherein men and women have increased their awareness and understanding of DRRM with the view of increasing people's resilience and decreasing their vulnerabilities. It ensures that the DRRM process is a comprehensive, integrated in all national, local development initiatives, covers all, involves all sectors, and engages communities, which is very important, at their maximum level of participation. It also ensures that resources invested in disaster prevention, mitigation, preparedness, and climate change adaptation are effective tools in achieving the stated vision. It also highlights the need for effective coordinated work in the delivery of humanitarian assistance and disaster response in order to save lives, minimize suffering, and protect the vulnerable groups of society. It illustrates the importance of identifying the risk factors and understanding that their interplay with other factors can translate hazards into disasters if left unmanaged. So on the screen, you will see that the evolution of DRRM is a logical step as first responders to a disaster, because they are more familiar with the local landscape and population. As emphasized by Senator Ligarda, the citizens must embrace it, and therefore at the very first level of family, village, community, village, municipality, province, and region, as indicated here. However, in a typhoon as strong as Haiyan, where the local government unit is itself a victim or severely affected by the disaster, it then falls to the national government to provide the response. In situations of mega disasters, the national government takes the primary leadership in delineating and establishing their roles and functions of all the DRRM actors, from the national agencies, local government units, CSOs, international relief and aid organizations, and even the disaster-affected public, to ensure coordination and convergence of all efforts. I think Haiyan had shown that the primary leadership of the national government must be in place within 24 hours so that we can be effective in ensuring the delivery of the immediate needs such as food and rescue operations. The National Disaster Risk Response Mechanism must always be kept ready to undertake rescue, relief, and response, as I said, within a 24 to 48-hour period. I would also like to note that while we're talking about national and local, we have to also mention that there is a humanitarian cluster approach which follows closely that of the UN Humanitarian Country Team. And here in the Philippines, we have this relationship existing with counterparts from the government structure. So this humanitarian cluster approach has the leads, as you can see there. I will not be reading it, but each UN or international organization has a counterpart from the national government, and it translates into municipal level, meaning we do our coordination at the level of the towns and cities, and we have an intercluster meeting. Right now, under the Haiyan operation, we meet once a month. The Ndrrmc utilizes this because it strengthens coordination, especially of international organizations, determine the first point of call responsibility, and optimize the support of government by complementing efforts between the United Nations, international NGOs, and the national and local stakeholders in responding to the priority needs of victims of disasters. Because I think it's important to acknowledge that the surge of compassion and support into the areas of Yolanda-affected provinces, towns, were massive, and what the challenge was for us after 2 weeks was coordinating everyone who wanted to be of help. From logistics, like planes landing into very small airports, to medical teams that have to be assigned, to the food distribution, to the people who are directly putting up their tents in different parts of Eastern Visayas. Now, I just would like to bring in the lessons from the national and local, which redefines some of the work that we're doing or enhances some of the provisions of Ndrrmc. So for one, it is important that information on vulnerability and hazards must be provided in popular form. Information was provided, yes, but I think the enhancement is that in popular form where everyone really would then understand. LGUs must be proactive in dealing with the information dissemination, particularly information on the scope and magnitude of hazards, in such a way that an ordinary person is able to understand and act upon that information. Not to panic, but to act decisively in a manner that prevents loss of lives and more disaster-like impact in their homes and in their community. In terms of mitigation, LGUs, especially those belonging to high-risk areas, must be able to preposition goods and personnel so that they can cut the response time and save more lives. LGUs must be able to step up as well the level of disaster response after 48 hours in conjunction or in partnership with the national government agency. For the national government, after the first 24 to 48 hours, national government in mega disasters must secure the peace and order situation, the delivery of food, the immediate cleaning of debris to make way for the road, and attending to immediate health concerns, including cadaver collection. It must establish a relief highway where additional aid and resources are able to flow. This can be accomplished by better coordination with all the other national agencies as well as countries and international organizations that wish to participate in the relief efforts. I think it's very important for us, especially on the logistics side, that we had support from World Food Program, who is the head of the logistics group of the UN Humanitarian Country Team, because that was very key in ensuring that food was brought immediately to the most remote places. We were using assets of trucks, boats, barges, choppers, all of which was coordinated by the logistics cluster together with our armed forces of the Philippines. I think it's important to bring in, and this is my second to the last frame, the perspective of what we are just saying, that the new normal emphasizes that poverty in itself is a disaster, and therefore we must address poverty, and as people gain back their ability to stand on their own feet, on self-sufficiency, then they can be resilient against disaster. So poverty reduction is not divorced from ensuring that you are resilient against disaster. It's a process that we should not forget, that in most of the countries in Asia and in the ASEAN region, we have to address poverty as part of our resiliency building effort. Because when they are self-sufficient, as families, as communities, their ability to prepare for a natural event and prevent a disaster is higher and stronger than their vulnerability when they are very poor. In summary, in all of this, what is key is scientific or evidence-based preparedness for disaster risk reduction that is known and in popular form that can be acted upon by citizens. Disaster responses must be guided by actual and verifiable observations and data on the ground. Communicate, coordinate, collaborate among all stakeholders in disaster preparedness, response, relief, early recovery, and rehabilitation. Communication is key in mitigation, disaster risk reduction, and disaster preparedness. Popular forms and easy-to-understand messages must be well within the hands of citizens so that they can prepare. Communications immediately after a disaster is important to assure the people that government is responding to their needs. The national and local government should continuously communicate with the population as regards relief, response, and rescue efforts, as this could mean life or death to people most affected by the disaster. Coordination with humanitarian teams and humanitarian actors is key, both national, local, national, and international. The humanitarian country teams, the cluster approach of the UN, international and local civil society organizations play a significant role in increasing the level of response. However, it is also important that they work in close collaboration with the national government and the local government. The private sector plays a very important role as well. Again, it's communication, it's collaboration, it's coordination that will lead to an effective collaboration. Thank you and good afternoon.
Distinguished delegates, we have about an hour before lunch, so we have about 7, 8 speakers left. May we call on, first of all, may we request that your presentations be limited to a maximum of 7, 8 minutes, and therefore we will respect everybody's human rights to food. May we now call on the presidential spokesperson, the Honorable Edwin Lacierda, to talk about faith. It's a tool for transparency and accountability.